Yeah, I think we are ready to start. So, hello everyone, and welcome to our event on the importance of education in the health system. Thank you very much for taking the time to join us today. My name is Xavier, and I'm the course advisor for the online and part-time medical and health education course here at the University of Manchester. But today I'll be mainly facilitating the session. So I am extremely pleased to be joined by an amazing amazing panel members for this discussion. We have here with us Dianne Burns, Nick Cooper, Jennifer Devine, Lizzie Gordon, and Harsha Parmar. Sorry for the if I made a mistake in the pronunciation. I will shortly invite them to introduce themselves briefly, and then we will move on straight to the discussion, which will be led by Dianne. After the discussion, we will open the floor to our audience for a Q&A session. So I invite all participants to use the Q&A function or the chat box to interact with the panel. Actually, I invite all participants to add a message right now in the chat to let us know who you are and where you are joining us from, so we have a better idea of who's here. To keep the Q&A session simple and fluid, we will only take written questions, so please feel free to type your question during the discussion. We will come back to them during the Q&A session, but you'll have time also to type them during the Q&A session. We'll try to answer as many questions as we can, but I can't promise we will answer all of them. I'm sure there will be a lot. If you are watching the recording back, and if you have any question, please feel free to contact me at studyonline@manchester.ac.uk. You can see the email address at the bottom of the screen. Don't hesitate to email me. I think that's it for me for now. So Dianne, as you are the first in alphabetical order, and as you are the course director for medical and health education course, would you like to start by introducing yourself, please?
Yeah, thanks, Xavier. Hi, everyone. I'm Dianne Burns. I'm a senior lecturer employed in the School of Medical Sciences and the School of Health Sciences here at Manchester. I'm the academic lead for teaching and learning within the faculty academic development team. And as Xavier said, I'm the programme director of this medical and health education programme.
Great. Thank you, Dianne. Nick?
Oh, hi, I'm Nick Cooper. I'm Associate Professor in Clinical Education at the Peninsula Medical and Dental School, which is under the umbrella of Faculty of Health, Plymouth University. And I've been, involved with Manchester for several years. I was external examiner of this course, or the previous course, some years ago. And for the last 18 months, I've been president of the Academy of Medical Educators, which is an organization to support educators, trainers, across dentistry, medicine, and veterinary science.
Great, thank you very much, Nick. Jennifer, it's your turn.
Good afternoon, everyone, and lovely to be here. Thank you so much for asking me to be here today. It's really lovely. So I'm Jennifer Devine. I'm the Professional Development Manager at the Christie. I am NHS career, start to finish. I joined the NHS straight from university and have just had my 24-year anniversary. So previous to working at the Christie, I worked for a specialist mental health trust and worked there for 20 years, 13 years in a clinical role and 7 years within education. And 3.5 years ago, I moved to the Christie as their Professional Development Manager. So my remit is around continued professional development, and I manage a number of work streams kind of within that portfolio. I have kind of oversight for our learning needs analysis for the organisation, all of the management of our various budgets and income streams that we have available to us. I lead on apprenticeships, on work experience and widening participation. I manage our SACT chemotherapy educator, moving and handling, and clinical skills. So I'm a little bit of a jack of all trades in terms of CPD and cover quite a breadth of different work streams to do with training and education within the organisation, covering all professions and all bands of staff. So every single member of staff is within that remit.
Great, thank you very much, Jennifer, and happy anniversary at the NHS. So, Lizzie, it's your turn.
Hi, everybody. Thank you very much indeed for inviting me along to this, what I think is going to be a really interesting conversation today. I'm Dr. Lacey Gordon. I'm currently now an independent health professions education researcher. Up until April, I was at the University of Dundee and lead for their medical education research group there, and also head of doctoral studies. And I've been working in health professions education for a number of years now. And prior to that, I also had a clinical background as a physiotherapist. So I've been in and was a very, very keen clinical educator as part of that. So been involved in health professions education for a long, I won't say how long, but for quite a very long time now.
Thank you
Even
very much,
longer than
Lisa.
Jennifer. Been here a while.
Thank you very much, Lisi. And last but not least, Harsha, if you want to.
Sure. Good afternoon, everyone, and thanks to Xavier for inviting me along today to what's going to be a very exciting panel discussion. My name's Harsha Palmer. I'm a senior lecturer in the Division of Pharmacy and Optometry at the University of Manchester, and I'm a clinical pharmacist by background as well for about the last 20 years. I'm also lead of our pharmacy education research group here in the Division of Pharmacy and Optometry, and I also chair the National Pharmacy Education Conference. With another hat on, I look after placements in GP practice and social care as well for our pharmacy students. And I also am the co-lead for prescribing skills on our curriculum. Thank you.
Great. Thank you, Harsha. Thank you all. Thank you. And thank you to the audience for participating in the chat. So I think my role is done for the moment. So I will leave the floor now to Dianne to facilitate and lead the discussion now.
Thank you, Xavier. Thanks for bringing us all together. I'm sure everybody will agree that we've got a very experienced panel here, so I'm really eager to get started. I guess, first of all, I'd like to start, if I may, by drawing on some questions that have been posed by our audience members in advance. So perhaps I can come to you first, Nick. Thinking about the challenge for education and educators in relation to the expansion of the NHS workforce and how we might best manage that.
I think it's a real challenge, isn't it? And I think when the workforce strategy has been envisaged by politicians, I don't think they ever consider the challenge how to educate that expanding workforce, both not only within medicine, but also across multiple healthcare professions. I mean, you were saying about working in NHS. I've actually retired from clinical practice after 40 years in the NHS, but still do academic work. And, you know, the time I had for clinical education years ago was much more than I see my colleagues now, who just don't have the time, but have the willingness and keenness to educate. But I think, you know, we really need to think, if it's going to be an increasing expansion, which inevitably will be over the next few years, how do we provide support for those, not only in senior positions, how they have time for education, but also juniors as well. I mean, I run a course for generic professional skills across the whole of the Southwest. And amongst that is many junior doctors who are probably 2 or 3 years away from a senior post in the NHS. And most of them are actually keen to have a role in education and training, but just feel so constrained how they're going to do that. They feel there's a sort of lack of career structure in terms of support within the NHS, and there's a lack of recognition sometimes in the workplace, how education needs space, time, resources, and all the other things that we know of. And I think with potentially a new government coming in the next couple of weeks, I think that's something that we've really got to push. I mean, I think the General Medical Council has done a good job over the last year, publishing numerous papers on this, saying the same thing. And Colin Melville from the GMC only published something in March, saying yet again, really emphasizing that this was a real risk in the system unless we provided that space for training and education. And valuing educators, in terms of their own careers as well, I think.
Yeah, some really valuable points there. Do any of the other panel members want to add to that?
I'd like to echo really what Nick has been saying in terms of we're all really aware of the constraints on resource in the NHS workforce, but not to forget, you know, as Nick said, there are so many people who are really keen to develop their roles in education and take that forward as a career, that we really need to nurture those sorts of things. And you know, this program, for example, is an excellent kind of pathway for starting to do that and being recognised and building those quality standards that we need out there in the NHS. There's so many new things that we can do, you know, thinking about embracing technology to address some of these challenges, which no doubt, you know, I'm sure the audience will ask questions around that later, but things like simulation and developing the skills to do that are certainly some answers to the challenges that we face. But succession planning is so important, and we can't forget that as educators and future educators.
Thank you, Harsha. Lucy?
Yeah, I mean, I tend to write notes as I'm listening to people, and think words like recognition, I think those are really important words, and value as well, and having that feeling of, I guess there's also that feeling of succession planning, but also that the responsibility, a collective responsibility of ensuring that the future is of our health services is safe, and that's through placing value on being an educator and being a clinical educator, but also having it as not necessarily something that's part. It's part of your day-to-day. It's part of your responsibility as well. But that comes from a sort of, I guess, a cultural shift of not seeing it as something separate, but seeing it as something that comes as part and parcel of our roles, but from an organisational perspective as well. So that's what I would add.
Yeah, I'd agree. I mean, medical and healthcare education is really expensive, isn't it? And I guess there's such financial constraints as well on spending, I guess, for education. Are there any ways that we can think about outside of the box? I'm looking to you, Jennifer, for inspiration here, but you know, because it's so expensive and we need to be able to deliver education and training that meets the needs of this future workforce, but also keeping costs down, is there anything that we might consider that might help us in that perspective?
I think it's very difficult, because I think we're always caught in a world where we want to do the absolute very best that we can do within our role. And there is a real commitment out there to sharing good practice and teaching and being in that educator position. But I think we have to be really, really mindful that if this just becomes an add-on, an extra burden and an extra task, rather than something that has got protected time or is built into the job description and the work stream, then actually you can be counterproductive, because we know that our staff, you know, on the back of COVID, and still, I think, even years on, in a little bit of a recovery phase from that. And I think we just have to be very, very careful that it's built in correctly, so that we don't have it as a burden, because if it becomes a burden and a nice to do and an optional extra on top of a full capacity, it's something that gets shelved and gets missed. And so I think we have to go a little bit more back to basics and back to grassroots. And yes, there's, you know, some great things we can do thinking around innovation and technology. I had some really interesting discussions this week about AI and other things that I know we're going to touch on today. So yes, there are options, and yes, there are possibilities. But for me, I think if we're going to really do a good job, what we need to make sure is that we are resourcing this as part and parcel of a job description. And our expectation is given the space and time it needs. Because if it's an extra add-on and an extra burden, it's not going to be effective and it's not going to get done. So for me, it's really considering the role of education within everybody's job descriptions and getting that that buy-in again that I think we did have, and I think has got lost a little bit along the way for me, to make sure that we really appreciate the value of what people offer in having that educational component to their day-to-day.
Yeah, there's a saying across Greater Manchester that education of our learners is everybody's responsibility, and I think you've all echoed that really, really well. It takes me to perhaps our next point is thinking about effective role modelling in education and teaching, and whether we see that as an integral part of our job for healthcare professionals. Can I come to you, Harsha, for your comments on that?
Yeah, of course, Dianne. So it's such an integral point, isn't it, to creating the next generation of healthcare professionals. When you think back to, you know, all the pedagogy and things around communities of practice, and how that, you know, comes about, thinking about our undergraduate learners in particular, when we place them in those settings, that's how they learn. They see one, they do one, they then, you know, perhaps later on in life go on to teach one. And it's from those role models that they pick up these behaviors. And we've all got such a responsibility, like you say, to be able to deliver on that in every aspect of healthcare, primary, secondary, etc. So that's really, really key. And I think, you know, Jennifer will probably agree with me that from a professional development point of view, it's seeing these role models, spending time with them, that we are going to build our next generation. But I think sometimes that in the workplace, you know, certainly when I'm in the workplace, morale is low, isn't it? With what's gone on in the last 4 years and with the lack of resource that we have, it's really tricky to always be that really good model. But bear in mind that we've got to try and keep that momentum going.
Thanks. And I guess patient safety is inseparable, isn't it, from that good learning environment and culture. So we need to create that culture that values and supports our learners in those kinds of settings. So how might we then, as educators, be much more inclusive to our practice? Jennifer, I can see your hand up. I'm wondering whether you want to comment on the previous discussion.
I was just going to say, I know that this webinar is forecast around healthcare professionals, but I just think for me, when we're talking about a learning culture, it's really important to remember that, you know, as I said in my introduction, my remit is all staff, and that is regardless of professional band. And actually, we need to be thinking of the whole workforce in its entirety. And I think role modelling comes down to everybody. So actually within non-clinical services, within corporate services, we need to be really raising the profile and showcasing the learning that's going on for everybody. And one of the big work streams in my remit is apprenticeships. And we talked about before about thinking differently and reframing a lot of the information around apprenticeships. You know, that's a big piece of work even now, even though it's been established for years. But showing that there are different routes, different ways, and that the more, it's like a snowball effect, isn't it? Somebody does an apprenticeship within the team, other people think, oh, that looks a really good option and a good idea, and the word gets out there, and we do some good PR and promotion and comms around these things, and it starts to show a learning culture for an organisation, not just healthcare professionals. I know that the focus of this webinar is that, but I think if you set that in the context of the whole organisation being a learning culture, that is kind of where you get that enthusiasm and momentum.
Yeah, thank you, Jennifer. That's really important. I completely agree with you there. It should be organisation focused, but then individually we can make a difference, can't we, in that organisation, in the way that we hold ourselves to those values. Lisa.
Yeah, just to say, and I think that, I mean, this comes from the research that I've done, that, and it's sort of, I put my hand up just as Jennifer said, everyone. And I think we're all role models. Everyone's a role model, whatever we're role modeling. So it's having that idea of, well, what exactly, really looking and saying, well, what are we role modeling? Because it can be good role modeling, and it could be not so good role modeling. And certainly my research has sort of shown that is people look ahead all the time. That's what they do. And as Jennifer says, I completely agree with Jennifer around the idea that it's an organizational thing and it comes from everybody and every and certainly the very positive learner experiences come from when they feel included and part of the environment, and that's all part of the role modeling as well. I think that, you know, we are always role modeling. We're role modeling now. You know, it's part of what we do, and we just have to be aware of it and make sure that it's positive.
Yeah, thank you, Lizzie. I think the importance of supportive working and developing those educational environments that allow that inclusive participation and mutual respect are really important. Thinking about the practical aspects of that then, and I'm going to come back to you, Jennifer and Lizzie again, is how might we as educators be much more inclusive in our practice? What kind of specific aspects do you think that we need to consider?
I think for me, we've spent a lot of time in the last few years focusing on some very specific topics, such as dyslexia or particular additional learning needs. And I'm speaking totally just from my personal experience within the system, both within the Mental Health Trust and within the Christie. And I think we've taken on board certain pieces of work and certain actions with certain issues and done that very well. So it's probably not uncommon now that when we put a presentation together, you'll see yourself, you know, that we give kind of a much more mindful consideration to the font, the colours, the way things are presented. And I think we've moved on in some aspects of those practicalities. But for me, I think we need to elevate that much more now. So it's, yes, there are some things to think about, inclusivity in terms of presentation of information, but it goes beyond that. So it's around not just how it looks, but actually really revisiting the content and thinking, if we've got, for example, a really neurodiverse audience, how is this meeting the needs of everybody within the room? And it's not just some of the basics around colours of screens, it's around thinking how our audience processes the information, and that might need to be different. And I think assessment is something else we really need to be thinking about, because I think, you know, there is a tendency, we designed a module fairly recently, and we were thinking, what is going to be our assessment process? And we had options around, was it going to be practical simulation based observation? Was it going to be essays? Was it going to be an exam, etc.? And I think there has historically been financial considerations around that. We know that doing a week's worth of observation costs more in terms of time and resources than marking an essay does, and we have to be realistic with our resources because they're not infinite. But actually, we were quite adamant that we wanted to do that observational assessment instead of an essay, because we believed that the nurses going back into practice would be much better rounded, well qualified and well practiced than somebody who'd written an essay on that topic. And we had 100% pass rate and a really good evaluation. But that was because we really kind of put it on its head and did it differently. And we know that exams don't suit everybody. They're not always a reflection of knowledge or of ability. There can be real barriers, you know, for apprenticeships, certain exams and entry criteria are barriers. So I think we have to be much more holistic in thinking around what is out there that is stopping people making progress, because actually it's not their skill that is the issue. It's the barrier of the assessment method that is the problem. Or is it that the content needs to be revisited and much more mindful of, you know, the audience members and what they might need? Because if we're talking about communication training, for example, and the models that we theoretical models we talk through for that, actually there's real implications around communication skills depending on where you come from in terms of your neurodiversity and your learning type. So it isn't a one size fits all. And I think, yes, we've done a lot of good work and we've thought about inclusivity in depth on some certain topics, but I think moving forward it needs to be much broader, and I think we really need to be removing those barriers. We see lots of barriers around digital literacy, so the move to things being online has been fantastic for a lot of people, but for others it may be that they have a job role that just doesn't involve being on a computer, so they don't have the access or the skill that they're doing a practical based job that doesn't involve being sat at a laptop in an office. Or we're asking people to do study outside of work time. They may be in a home where there's no computer or one computer, but it's shared amongst the family and people are using it for school and all these other things. So online learning's brought a lot of benefits, but it also is a barrier. And I think we just need to remember that in the enthusiasm of online or all these different things that we have available, it's not appropriate for everybody. And are we really kind of delving into what our audience needs? And that for me is about being inclusive. It's not just awareness, it's acceptance of need.
Yeah, and I like that.
We know about it, but actually what are we doing? And it's not a superficial tick box of doing little bits, but it's just inbuilt into our practice around delivery, thinking about barriers all the time and what we do to get the best out of people and not stop them from progressing.
Yeah, and I like that you've drawn on examples from beyond neurodiversity, because yes, I think you're quite right. Culture, generational aspects of education, country, where you live, how you might access resources. I think all of that has a part to play, doesn't it? And neurodiversity is just one aspect of that. Lissy, you wanted to comment, didn't you, on that?
I think so. When I thought about that question, I think again, I sort of tend to think more around the clinical education environment. And so for me, inclusivity involves accepting difference and encouraging difference and encouraging voices to the table. And so from a clinical point of view, I mean, within the confines of the clinical responsibility that people have, when I think about learners in those environments, maybe being invited to be part of that and included in that as well. So that's apologies. I have a puppy who's growling in the background because he's playing with us. So for me, inclusivity also means, again, it goes back to that idea of integrating education in the day-to-day, therefore integrating our learners in the day-to-day. And so, again, a slightly different example, I guess, from Jennifer's, but that for me is making people again feel valued through their difference as well.
Yeah, thank you, Lissy. I agree with everything that's been said. Such challenges to think about when we're trying to be massively inclusive for everyone. And I guess it comes down to, I know at Manchester we rely heavily on mitigating circumstances to be considered, but actually that mitigation could be anything from everything that you've discussed here. So just moving on slightly, I don't want to say that we're running out of time, Xavier, but the conversations here and the discussions are really interesting, aren't they? But just to move us on a little bit, because I know there's been some questions in the chat and we've had some questions in advance about the use of AI. So as healthcare educators, we now have this vast array, don't we, of modern technological advances that we can utilize to help us to assist learning and education. But how do you think the impact of artificial intelligence is going to influence our role as healthcare educators in the future? And I'll open that up to all members of the panel to respond there.
Okay, so shall I come in first? Sorry, my hand doesn't seem to be working. I mean, I think it's a bit like some of the comments already. You know, if we'd thought about online learning and Zoom back in 5 years ago, we'd have sort of thought, you know, that was a bit peripheral, wasn't it? But now it's a sort of key part. But as we've heard already, I think there's a danger to assume that it's helpful for everybody. There's lots of other things. We're talking about community of practice. So I think we've got to be aware that AI is going to be helpful for some people, but not for others. And if some educators are so keen on AI, will they try and push that on their learners without thinking about what the learners' needs are and the learners' helps are? Having said that, we've all got to think about the generation coming through as we go to Generation Alpha. They're going to be doing AI at the age of 4, aren't they? And they're going to be very different in a sort of decade's time, those sort of learners. So I think we've got to embrace the technology, but we've got to think about the positive effects of it, but also back to the EDI question again, you know, the availability of access to online materials for those who you know, may not be able to get it so easily, and certainly in terms of equality. And I think that links back a little bit to all I've heard about neurodiversity. We've done a lot at the university about recognizing neurodiversity, which gets really recognized in the first and second year undergraduates. But then they go out into clinical practice and it completely gets unrecognized, and they feel very marginalized because suddenly don't feel valued. Whereas perhaps in the early years when it's a more university structure, and it's around thinking about giving them extra time or support or teaching them in a different way, whether it's through AI or whether it's through, you know, more one-to-one interaction or whatever. So I think, yeah, great possibilities, but I think we've got to think about the risk benefits and those groups that might be left behind, I think.
Thank you, Nick. Any of the other panel members? Harsha.
Yeah. It's funny how my husband and I were having this conversation the other day about AI and looking at our own children and seeing, you know, what are they doing with it? And they don't use it in the sense that I see our students using it, but there is going to be a generation, you know, who are 3 or 4 now, like Nick says, who this is going to be absolutely normal to them. They won't know life without it. And maybe I'm going to be controversial here, but I don't fear it. I don't think it's something that we need to be scared of. I see it as a way of potentially enhancing social mobility. I'll give you my own example. So being an Indian, I'm British Indian, so my parents were from Kenya. I was born here. And certainly when I was at school and we were doing English, there'd be phrases that were used, very colloquial phrases. That's not the language that I heard at home. I wouldn't know what certain phrases meant. And I'd look a bit stupid sometimes, you know, when the teacher would ask me in particular, and I'd just come out with probably what the obvious was, but not understanding the meaning behind it. And I think there are still lots of, you know, groups of people like me who don't have that language at home, and using things like ChatGPT just to understand, you know, what do they mean by this, and is this, and it removes that barrier of looking silly and trying to understand a different way of life from other people, and that then potentially that does move you into a different social class later on in life because you know what others know, which you don't know at home. So I think potentially for that kind of use, it's really helpful, but also accessing it as a way of practicing, for example, case studies. So, you know, there's lots of websites, for example, that allow you to, you know, put in patient cases and give you a little bit of extra practice. And if you don't have access to that by other means, then this is a way of, you know, you working with a group of friends to do that. So if anything, I don't think it's anything to be scared of. Obviously, we have to teach people, our students in particular, how to use it responsibly, and, you know, the do's and the don'ts and how to, you know, how not to get in trouble with it. But I do see it as a way of equalizing things for a number of underrepresented groups.
I guess I'm thinking for us as educators, I guess what our challenge is to be able to assist in our learners and students to be able to use it critically for them to be able to critically validate what AI is generating. And yeah, I think the challenge for us is to not lose that. I know in healthcare that there's lots of AI approaches out there already, isn't it? And I think my worry, it's not a main worry, but the worry is that we're going to rely on AI too much and actually not have the ability to critique the output of AI in the future. Jennifer?
I was just going to say exactly what you've just said there, that I think there's loads of advantages, and I can absolutely see it becoming more integral in the work that we do and for learners. But I have the same concern that if we rely on that technology to produce some of our work for us, are we losing some of the skills in gathering information and putting things together? And in terms of learning, is it leading to learning that is a little bit more at a superficial level than that deeper, rich level of research and evidence gathering? So it's got loads of benefits in putting together, you know, paragraphs and information and things. But, you know, I think we need to be careful around, if going back to assessment criteria, if the assessment criteria is around assessment based and assignments in written work, and I think there are some implications around things like plagiarism and Turnitin, and how do we know that this is authentic and not, you know, being used for the wrong reasons? Make sure that it's used for the right ones.
Well, thank you, Jennifer. How are we doing for time, Xavier? Have we got one last topic we can look at, or?
We're doing good. We're doing good. Yes, maybe one last topic, and then
Okay.
we can open the floor.
Okay, so the last topic that I want us to consider is around us as practitioners being really familiar with critical reflection in our practice and the use of evidence-based practice, particularly in clinical environments. But how do we consider that in terms of our roles as educators? So why is critical reflection and evidence-based practice in healthcare education important? I'm wondering what I'm wondering if I can come. Oh, Jen, I can see your hand up. Is that a legacy hand, or is that no? So I'm wondering whether I can come to you, Nick, as the former president of the Academy of Medical Educators, because they really hold reflection as an important aspect of professional development, don't they? I'm wondering whether you might want to comment on that. Oh, you're on mute.
Yeah, I mean, I've done quite a lot of reflective work on practice, both in terms of educational reflection, but also the issues of reflection with learners and the challenges for that, and especially those working in the NHS. Certainly junior doctors working in the NHS find that reflection gives them a negative connotation because of the way it's used, I think, and the way it's misunderstood by supervisors and others. So that's one thing. But what I say to people, you know, you wouldn't go into clinical practice without thinking about evidence of what may be useful and what may be useful and what's out there. So it's about having that scholarly approach to your teaching rather than just doing what you think might work. But what is the evidence around what might work? And especially back to all the questions about inclusivity again, and dealing with the sort of range of neurodiversity. What is the evidence? What sort of format of education helps? So I think that's part of your critical reflection then, to develop that about if you've had a teaching episode or a clinical teaching episode in practice, thinking, well, did it go as well as you thought? Or why didn't it go as well as you thought? Was it because of those approaches? What was it about not thinking about primarily the needs of the learners? Because I think so often it's not thinking about the needs of the learners, it's thinking, oh, this is what I've got to cover and that's what I've done. And as you say, the Academy, to professionalise the roles of educators, and now we've got the Public Professional Registry, is very much about reflecting on your practice. And John Sanders, who many of you may know anyway, from Manchester and Sheffield, now at Edge Hill, he does a lot of work now with the Academy on reflective practice as well for educators.
Thank you, Nick. Lucy?
Yes, so I have a bit of a take on this. So there's a really great paper written by Anna Delacroix about reflective zombies and how careful we need to be not to become just reflecting for, you know, and trying to look, well, what is the benefit of reflection, and really understand. And I think sometimes people don't necessarily, they do it because they have to. And I think that's one of the things that Nick was alluding to as well, is that people ask, well, what, you know, you have this sort of set, and often there's a cycle, a process that we go through, and we look at, and then how does evidence, how do I understand what happened? And I'm much more of an advocate for reflexivity, which is a slightly different thing, in that it's also about how have I changed as a result of moving forward? How does my worldview look different now after that interaction or after that piece of learning? How do I see the world, and how does that move me forward? So also thinking not just thinking in a looking back way, but also thinking in a looking forward way as well. And I'm more of an advocate of thinking more about being reflexive, and how am I in this world, and how does that affect what happened, and my understanding of what's happening, and how am I different now? So I think there's an advocate, but then there are risks associated with that, where people do it because they should. And I think that one great way to be sort of active, reflexive practitioners is through storytelling and telling and narration, and sharing stories and sharing thoughts. And it goes back to that whole, the inclusivity of sharing experience, and what that experience was like for different people. And I think that then creates an environment where actually it's a valuable task. Being reflective or reflexive, it has value to it, and it's not being reflective or reflexive for reflection's sake.
Much more transformative then in
Yes.
what comes out of that in the end. Thank you, Lissy. Harsha?
I think I was just going to say, similar to what Lissy was saying, in that none of us know it all, do we? We're all, taking that opportunity to reflect really gives you that growth and insight into yourself, the situation that has taken place, the impact that you're having on the learner, or, you know, those around you. And going back to role modeling, if we're able to do that, then that's it's a responsibility, isn't it, that we need to take to be that reflective or reflexive practitioner. And it makes our learners see that we're human. You know, we're not up here and they're not down here. We're just normal people. We make mistakes. We learn from things, we grow, we improve. And I think that really helps with approachability of connecting with those that we're working with, or perhaps we're teaching. And I think going back to some of the applications or ways, if we have to assess reflections in particular, it doesn't always have to be a 10,000 word essay with a Gibbs cycle, does it? It's it's like Lissy says, it's that storytelling. You can make it informal, you can make it a break or lunchtime opportunity where you can just, oh, this happened today, and this is where I'm going next. I think a good colleague of ours, Judy Williams, always used to say to me, so what and what next? Always think about those two questions in terms of where you're going, and that's like, your light bulb moments, isn't it, in terms of reflection? So I'll stop there and hand over to someone else.
Thank you, Harsha. Finally, to Jennifer.
Yeah, we've been doing a lot of work recently around clinical supervision, what we want our clinical supervision training and our clinical supervision CPD to look like, and linking that with a lot of work we've done around the professional nurse advocate. And so, tiny, a little bit at a tangent, but just under that remit of reflection, learning, and like you said, what action comes from it, I just wanted to make the point that I think we shouldn't underestimate the well-being element of reflection. So yes, it's a learning and an education tool, and something that shows you know, our role modeling and lots of the things that we've talked about in this session today. But just a kind of an observation really is that, but when we, you know, Nick said sometimes we look at reflection as a negative, and I think that was the connotation with clinical supervision. It's a remedy when you've done something wrong, or that was the history of what it was about. And I think we're really reframing that now. And yeah, just not to underestimate the importance and the value of reflective practice as a wellbeing tool, especially in the kind of environment that we're in now, which I do think is different to what we've ever faced, you know, in the past.
Yeah, thank you, Jennifer. I think we could go on all day, couldn't we, as a panel sitting here and chatting and discussing some really interesting topics we've addressed. But I'll hand back to Xavier now, because I know that we're reaching our time, aren't we? If not, we've gone over it, Xavier, but I'll hand back to you now.
Yes, it just made me realize that we could probably have a series of discussions like that together, but maybe in the next months. We will open very shortly the floor for Q&A. So and we'll probably have just time for a couple of questions. So I invite the audience to write their questions in the chat box. Maybe to give you a minute for the panel to rest a bit, have a glass of water maybe, and the audience to think about questions or type them. I just want to take a minute to briefly introduce our medical and health and education, medical and health education course. Let me go back to sharing my screen. So as we mentioned, probably this online and part-time course is suitable for all experienced clinicians and healthcare scientists, including medical doctors, dentists, nurses, pharmacists, and all other allied health professionals involved in teaching, learning, and or assessments in the workplace. This course has been created in collaboration with the Royal College of Physicians of Edinburgh. So this means that students cover the latest in theory and practical approaches to education related to current challenges in healthcare. It is also accredited by the Academy of Medical Educators. So as well as a great recognition of the course quality, it gives the opportunity to those who have completed the postgraduate certificate to apply for full Academy of Medical Educators membership and bypass the full application and assessment process. Students can complete a full postgraduate certificate in as little as 12 months, but they have up to 3 years to complete the certificate if needed. So you're not obliged also to commit to the full PGCert. You can also choose to take individual specific unit. Each unit bears 20 credits. So that's what we call the CPD route. The postgraduate certificate is made up of 3 taught units. The first one is the reflective educator, the second is the art and science of teaching, and the third unit is pass or fail who decides. So I'm sure that lots of what has been said today is tackled in those 3 units as well. So I invite you, if you're interested, to look at our course webpage to have more information about the units that are offered and what they cover in more details. All units and assessments are delivered online. So as I mentioned, it is a part-time course that has been specifically designed to be delivered online. This means that students can organize their studies around their work and personal commitments. And it's also important to know that there is no final exam. The assessment is continuous. We recommend students to spend 20 hours per week on their studies. This includes watching lectures and video content, reading, joining live tutorials, participating in discussion forums, etc. There is a variety of different activities students will engage with. So once again, please have a look at our webpage for more information. Last but not least, money. We have some discounts available. So if you are an NHS employee, you can get, for example, 10% discount on the tuition fees. We also offer corporate discounts to organizations sending a certain amount of colleagues. And finally, we have the alumni discount. If you have successfully graduated from a credit-bearing qualification at the University of Manchester or UMIST, you may be eligible for it. So please know that we apply a 1 discount policy. If you're lucky for more than one, to qualify for more than one discount, you'll be awarded the one that is the highest amount. So once again, feel free to contact me at the email address here and shared on the slide, studyonline@manchester.ac.uk if you want more information. So I'll stop sharing and let's go back to the question. Let's go to the questions. And let me see in the chat. So question for, maybe while I go through the chat, I would like to ask maybe a question that was sent from someone who registered at the registration page. So the question was, what is the role of interprofessional learning in large cross-cutting themes, including sustainability? I thought that was an interesting question on a matter that we didn't really.
Yeah, I don't mind opening up on that one, Xavier. I think there's a real place for interprofessional learning. In clinical practice, we work in interprofessional teams, don't we? And the more effective we are is when we're working interprofessionally and supporting one another. And I think there are some areas that we could really focus in on interprofessional learning, such as communication, communication skills, team working, lots of areas, and that would perhaps help us to be more sustainable in the way that we deliver. Is that, you know, if we're delivering cross-cutting interprofessional themes, then we're not having to deliver it in silos over and over and over again. So that might help us with the resourcing. But I'm wondering whether Jennifer has anything to add there as well.
I was just going to write that I agree with everything you've just said there. Yeah, absolutely. I mean, as a department and a team, we are really, really pushing the ethos of multi-professional approach. And so, for example, we used to have 2 different study funding policies, one for our medical colleagues and one for everybody else. We've amalgamated them and put them together because actually the process for everybody, every single member of staff for us is the same in that they all have a right to CPD. And we are looking at where we used to do purchasing of courses for specific audiences, actually really questioning why is it just for that audience? Can we not do it in a multi-professional audience? Because actually the richness in learning comes from learning from your colleagues who are in different positions, different bands, different roles. And if you're always sat with the people you're always sat with, you are always going to be hearing the same things. And actually, you need to hear some challenges and some differences. And that comes together when you bring a group of different people together. So some of our, particularly some of the medic courses that we used to have a very tight remit around have changed over the last 2-3 years. So I think I'd say now 75% of them are advertised as a multi-professional approach, because there were topics like consent, preparing for court, you know, different legal aspects and things like that, but they're applicable to everybody. So why are we targeting just a certain group of staff with that? So we've really broadened our approach and try and use our language very carefully and very purposefully to describe a multi-professional, all-encompassing service. We don't look after just nurses over here and, you know, somebody else over here. And I think the other thing for us is exactly what you were talking about, scale and budget. So we know, don't we, that we have budgets that are ring-fenced. But if we have a mixed audience and you can take a little bit of money from each because you've got different audiences, then it's spreading the load and getting much more value for money. And you're not having to repeat events. You know, you can run it once and run it well and run it with a big mixed audience instead of smaller several times through the year with different pockets of money. So there's loads of benefits to working in that way. And it is a bit of a shift, I think, for some people to take on board doing it a bit differently. But the feedback has been really positive, and we're talking about communication as well. A way to open up that dialogue within practice is to have a mixed group sat in a room doing their training together and having some of those conversations, because it translates back onto the ward and back onto the you know, into the workplace.
And I think you hit on something really important, though, is that opportunity to discuss from different perspectives, look at things through different lenses within the same session. And those are the things that assist transformation of learning, isn't it? Those are the things, being able to listen to somebody else's perspective and see it from a different lens, which is going to transform the way that you think. So thank you very much, Jen, for that. I've seen a question in the chat, Xavier, from somebody that's saying that they don't currently practice in the UK, but they do have a medical qualification. Are they eligible to apply for the PGCert? And yes, you don't have to be practicing in the UK or even be qualified in the UK. The equivalent qualification elsewhere across the world gives you access to apply for this PGCert. So please don't feel that we've not been inclusive in that way. Is that you know, you can apply from anywhere as long as you fit the criteria of being a healthcare professional, and that in all its senses as well, not just a medic or a nurse or a physiotherapist, but we try to be very inclusive of all the healthcare professionals out there.
Thank you, Dianne. I think it answers as well another question we had. Do you have to be a clinician to be eligible for this course? But
no,
you don't. So, I'm very cautious of time, and I think we had lots of comments during the discussion, and and I think we've answered the different replies, and the discussion itself replies to most of the questions. I think we arrive now at the end of this event. I'm just launching a quick poll for our audience. I want to thank you all. Thank you everyone for your participation. I would like to thank again very much our panel members for accepting to join us today and for sharing your insights, perspectives, and experience. I think it was a very, very, very interesting discussions, and your participation was very valuable. Thank you very much. And we will finish here for today, and so I will stop recording, but thank you all for joining us, or for those who are watching back, thank you for watching back.